Hi, everybody. This is Dr. Shaw with Shaw Medical Travel Consultants, and today we have the pleasure of interviewing Dr. Aneita High, who is a psychiatrist. Welcome, Dr. High.
Thank you. Thank you for having me again.
And today we're going to continue our conversation about volunteerism and mental health. And so this is part two. We previously talked about the effect of volunteerism on children and those who are receiving the services. But today we're actually going to talk about mental health effects of volunteerism on the volunteer. So those who are offering the care, we're going to chit chat a little bit about that.
Mm-hmm.
So Dr. High, thank you for being here with us again. Let's just start again, like we usually do, with sort of a general overview of this topic particularly, and the significance of this topic. I guess put it into perspective for us.
Yes. So, I mean, in perspective, volunteerism is volunteering in general is really healthy. Being altruistic, thinking of others, doing something for someone else is a very healthy way of expressing yourself. It also brings a lot of positive feelings, but there can be some negative mental health implications for volunteerism. And I think it's important for people to think about that when they are looking into taking opportunities to go abroad and serve. And so some of those negative impacts could be related to, not having a realistic expectation, glamorizing what the experience might be like, and then being really disappointed.
It seems that would be important.
Yes, yes. And then also recognizing your limitations, not just physically, but also emotionally. A lot of people who are coming from higher income countries haven't really been faced with the level of poverty and pain and suffering that you will see in a lower middle income country. And it's very different when you're meeting people, you're connecting with individuals, and you see their circumstances as opposed to just hearing about it. And so being aware of that and how it might affect you emotionally is very important when you're looking at opportunities to serve abroad.
That's huge. So with that as a segue, what are some of the positive? Let's start with positivity here. So what are some of the positive mental health benefits of volunteerism?
Well, first of all, volunteering gets you to stop thinking about yourself. Whenever we think about ourselves too much, it's usually not very healthy. It also helps us put in perspective our circumstances. I love the expression that someone's always doing better than you, and there's always someone doing worse than you. This is bad, but it could be worse. And it's easy to say those things, but then when you see it, you're able to really say, okay, this might be really challenging and difficult, and not to negate it, but you're able to walk away from it, take it back and take a look at it and put it in perspective in a bigger picture, which is always helpful. As opposed to focusing on yourself. The other thing it does is it also lets you know that you can do something positive. A lot of times when people are volunteering, and especially if they haven't volunteered before, it's a sense of value that, wow, I can do something that's going to make someone's life better, and it's not about me. Which is huge, because oftentimes we can get so caught up in like, how's this affecting me? How is this going to benefit me? And it becomes that rat race of just keeping going and feeding self, really. But pouring out to someone else and then seeing someone else receive joy or resources or any of those things. It's very positive and creates endorphins and all these great chemicals in our brain. So there's a lot of positive aspects of it. I have the opportunity to lead a lot of youth trips with adolescents, kids from the age of 12 up until 18 or early 20s. And again, putting things in perspective, especially in this day and age where there's so much focus on social media and getting likes and really being affirmed for a lot of superficial things.
Yes. Yes.
Which is unfortunate, but it's a very superficial things. So to be able to step into something tangible that requires personal interactions is hugely beneficial. You know, nowadays you have to give them 2 or 3 days to withdraw from their technology, but even that, having like real FaceTime with human beings, having a conversation, doing those things, so important. And even for adults, like so many of us, especially in this day and age, we're working at a desk, isolated in front of a screen, and we're lacking that human connection. So there's all these positive benefits of being able to volunteer and work alongside people, work with people, and serve others.
Right. I was going to say too, especially now with COVID, everybody's kind of locked up at home and haven't been mobilized and hasn't moved, and everybody's got cabin fever. So, you know, and I guess that would also lend itself to that sort of self-deprecation or self-pity, and we recognize all the bad things about self and me and my situation. So I can see that.
Yeah.
So now, tell me a little bit about some of the negative issues, okay? Those negative issues as it relates to the impact of volunteerism, as we said in the beginning, on the mental health of those who are offering assistance or offering care.
Yes. So kind of going further into the idea of being exposed to maybe suffering, poverty, pain that you might not be accustomed to. I think people need to be aware of what might be triggering for them, especially if they have experienced certain traumas in their lives, if they have, if they're going through a certain transition. Volunteering, especially in another culture, in another country, it can be very emotional.
Yeah.
And what also happens is you've let your guard down. So if you've been working, doing your routine, and now you've stepped away from that and you're focusing on something else, but you've also given your mind, your body, a chance to rest and recalibrate. Even if you're working, you're out of your routine. Things that you might not have dealt with because you were just in the rat race, doing your day-to-day, starts coming up, especially if you haven't dealt with it. And so being aware of the type of work you're doing. So if you have a history of maybe of a contentious relationship with a spouse or a parent, and you're dealing with people who are victims of DV, or if you've experienced childhood trauma and now you're working with children who have trauma, don't be surprised if some of these things trigger you and you have a greater emotional response than you would otherwise. That's very common. And I think maybe underreported, or maybe not understood as much as like, why am I responding so strongly to the situation or whatnot? And usually it's because it's also triggering something that's inside of you that you really haven't dealt with.
So I think that's key. But I want to ask you this though. So a lot of times people say, well, you know, I've been through so much trauma in my life, and I don't want anybody else to be like me, and I don't want anybody else to go through this. So therefore, I'm going to go and help, particularly in this vulnerable population, because of what I've been through. And so I feel that I have that real life experience that maybe I can share. But you are saying that doing that could trigger negative emotions.
And I think there's a difference between people who have gone through those traumas and healed,
right,
and people who have gone through those traumas and they're wanting to serve as a way to avoid healing.
right. So tell me something. How are you gonna know? I mean, well, maybe I haven't gone through therapy. I guess healing would be, maybe I haven't gone through therapy, but I've done this, I've done that. Maybe I feel okay. I'm good to go.
Yeah.
How do I know? Because I don't want to go all the way to Kenya and realize, oh my God, no, I'm not healed. And this is just making a big old mess. So how do I know I'm healed?
Yeah, and healing is a journey. So there's never like, okay, here, I'm there, whatever.
Right. You don't get a certificate.
Exactly, right? Like, okay. And now you're done.
I get it. I get it. Bingo, got that. Okay.
But I'll give you an example. Like, if you've just gotten out of an abusive relationship and you've been divorced for less than 6 months, it's probably not the best time to go and serve vulnerable women.
Right.
Timing is everything.
Yes.
And it's not to say that people can't help when they haven't been fully healed. That's not what I'm saying at all. But when you're in those situations and you're helping to avoid your own the hurts that are still there at the surface, you may be doing it more for you than for the other person.
I see that. Mm-hmm.
And that's where, can someone be helped still? Absolutely. But it might put
it might set you back. It could set you back.
Exactly. It might put a detour in your recovery. And so, making and how do you know if things are still right under the surface? It's probably not a good time. If you can't share your story without being triggered,
right,
probably not a good time. You probably still need some wounds healing there, Right. And so those are things that I think people need to be aware of. The other aspect is people who are challenged with chronic mental health issues like recurrent depressions or anxiety disorders or eating disorders where you're managing your symptoms, but you still have to work on the issues, or you're still in treatment for your mental health and your illness and all those things. So those are things that I think also need to be considered. One,
go ahead.
Consult your care team, whether it's your therapist, your counselor, your doctor, your psychiatrist, whoever. Consult them and, okay, what do you think? You think I'm okay for this? Do you think this is a good idea? Consider the time of the trip. Okay, a 2-week trip is really different from I'm going to spend a month in another country or 3 months in another country or whatever. If you have something like a bipolar disorder or a mood disorder, how do you deal with time changes? All these things can be destabilizing. Even really positive emotional experiences can be destabilizing. So just because it's not a bad thing doesn't mean it can't be destabilizing if you're not prepared for it.
Right. And the downside is if that does occur, you're in a place far from home, and the ability for you to get on the right track or get some treatment or something like that is probably slim to none.
Yeah. And so being aware of, okay, what are the services that are available? And, spend that extra $120 for travel insurance, where if you need an urgent removal from a situation, it's there. So having that, being mindful of those things and doing your research to make sure that, okay, I'm okay with this. The other thing I would mention is be honest about disclosing what you go through. because
you're not necessarily honest with yourself, because that's number one, but honest with those who you're going to be working with and working for.
Yes, because most volunteer programs will have you fill out some type of health questionnaire to make sure that you can do the things you say you're going to volunteer to do.
Right.
But if, you know, just make sure, okay, are you on medications? If you're on medication, say yes, even if it's an antidepressant or whatever it is, because hiding those things, and then if symptoms arise, you might be stuck and people might not be able to support you in the way that you need to be supported.
Right. Correct.
And now, that's really important.
Yeah, got that. You touched on something earlier, so I want to sort of go back to that. You said something about, say, for example, and this may be an extreme example, but I think it's a good example, the issue about a country that suffers from food insecurity, or maybe even a different part of the United States that suffers from significant food insecurity. And you have to be in this environment for a couple of weeks, or like you said, even extended time period. I mean, that could be a significant trigger.
Yeah, absolutely. These are things that, which I say, like, consult your care team, consult your family and your support system, because they may be able to give you some input that you might not have thought of. What are some things to, you know, come up with a plan. Don't leave with, it's all going to be fine because I'm volunteering. Like, don't do that. You know, and again, recognizing that the type of work that you do, the population you work with, may trigger things for you, may cause exacerbations, be destabilizing, and come up with a plan on how you're going to manage that. You know, and if there's a leader in your team or the organization, you might let them know, okay, if X, Y, and Z is happening, that means I'm not doing really well, and I might need to.
Okay, so be transparent.
Be transparent. Now, there may be organizations that are more comfortable with that than others, but you should know that.
That's right. It's important, you know.
Yes, and if they're like, oh, we're not sure if we can handle it, then that's probably not the organization for you, but there are plenty that are. And understand that, you know, many people are challenged by mental health issues. That doesn't mean that they can't serve, they can't help, whatever, but let's make sure we have the right resources in place to support them if they're having challenges on the ground.
Excellent point. That's a good segue. So we're in a situation now where, you know, we have COVID, PTSD, we're all locked up in the house. We haven't been out for a year for the most part. So I'm just burned out. I'm just fatigued. I'm tired. I'm at the end of my rope. I just got to get out of here. So I'm going to go volunteer. Okay? I just can't handle it anymore. I'm going to go volunteer.
Yeah.
What do you think about that?
Why not go on vacation? That's my first thought. So I think there's a real difference in going to volunteer on purpose versus going somewhere to volunteer as an escape. And when you're going to escape, I like to tell our kids in the program, wherever you go, there you are.
Right.
So whatever you're escaping, you're bringing with you.
Right.
And sometimes we need to escape, and that's okay, but that's probably not the best situation to serve under.
Yes.
Because then it becomes very egocentric, and you may be looking for results to validate your trip and volunteerism as opposed to helping the people you've come to serve.
So come in with sort of a clear agenda.
Exactly.
With a blank slate, you know. Is that kind of?
Yeah. I wouldn't come with an agenda of I'm going to change the world, I'm going to save these people, and it's going to be amazing, because that very rarely happens.
Yes. Yes.
And to be honest, I mean, the times that I've gone and I volunteer, I definitely get more out of it than I feel like I've given.
Right.
So it's that place where judge your motives, go with the right intentions. And if you need an escape, you don't need the excuse of a volunteerism to do that. You just own, I need an escape right now, and that's okay.
So if I'm on vacation,
yeah.
Okay, so let's take this, let's ride this story out just a minute. So
Yeah.
so I say I need an escape. I go on vacation. Maybe I go on vacation for a month, or something, a couple weeks or something like that. And there's this opportunity that I can embark on while I'm on vacation. Good idea, or just deal with the vacation, get over my issues, and come back?
I don't feel like having escape is a necessarily means you have issues. It just means that you need a break, which we all do sometimes.
Right.
But if you find something that speaks to you and you're like, wow, I really want to connect to this, I think that's part of the beauty of traveling, is like you stumble upon these individuals, people you meet, opportunities, activities that you're like, oh wow, that was so much more than what I anticipated. And so being open to those experiences, I think, is different from going with the agenda of escaping.
So volunteers who already have mental health issues, diagnosed mental health issues, they may be on medications. Well, what are some of the things that they need to contemplate when they're going to a different country? You touched on this a couple times, but more specifically.
Yeah, so like, for example, if one of my patients was like, hey, Dr. High, I want to go on a 3-month service trip, whatever. Then first of all, depending on where are they in their in the management of their illness, are they just get out of an acute episode of a depression or panic attacks or manic episode or whatever, or have they been at a stable place for a while? I would not recommend any major changes. I wouldn't make too many changes at once. So so that's number one. Know where you are in your illness management. If you are in a maintenance phase and things have been really stable, that's fine. Know your triggers. If you are triggered by lack of sleep, going someplace where there is a huge time difference means that you really need to work on getting on that time schedule quickly. So that it doesn't go into a problem. Like I said, being aware of what mental health services are there. Are there psychiatric hospitals in this country? Yes or no? What is the level of care that's offered there? Is it equivalent to what I would find in my home country? Yes or no? And then if I get travel insurance, does that cover a psychiatric emergency? Because depending on the insurance, it may or may not. So those are probably some key things that I would consider if I had a chronic mental health condition, or I was treating somebody with a chronic mental health condition that wanted to go on a long-term or even short-term volunteer trip. But I think it's also important is just being mindful of volunteer guilt. When you return from your experience and you come back to your comfortable life, it's not uncommon to feel just shaky. I can tell you, every time you come back from Kenya, there's always an adjustment period for me. Conveniences are available to me just because I'm here. And I'm no better than anybody else. So it's something to be aware of, and just allow yourself to go through that transition and not be like, okay, what's so great? I had a great time. What's happening? And if you have that like lull or just not feeling yourself for a couple of days or weeks, depending on how long you're gone and how long you've been back, that's part of it. And recognizing negative thoughts that come into your mind. And so, but it's also good. So be easy on yourself.
Yeah.
But also, it might also let you know, okay, I can make some changes. Maybe I don't need this much stuff. And so I think that's also a very positive thing about going and volunteering someplace else. It gives you a fresh perspective. It's a nice reset, and you can carry some of those internal changes with you.
I love that. You touched on this a little bit, but you know, if you've had traumatic situations in the past, you may be a victim of sexual abuse, domestic violence, you know, or maybe you were in the foster care and you just had bad experiences, and you want to go to volunteer. You've touched on the issue of triggers, but I mean, anything additional you want to say about as it relates to what you need to know about yourself or anything like that?
What I can say is that you could, depending on where you are in your journey of healing, you could also bring a lot of hope.
Yeah.
And so it's not oh, I've gone through this, I'm not qualified, or I can't do it or not. I mean, you may be in a place where you're that person who's like, you know, I've been through this and I can tell you there's hope on the other side.
Yes.
And so don't hide from your trauma, but be mindful of where it is in your journey and how you are bringing it to the people you are serving, because it's a part of your experience, and we bring our experiences with the people that we serve.
Yeah, absolutely. Key, very key. Okay.
Yeah.
This has been great. That's fabulous. So I've enjoyed myself as usual. So thank you for all this insightful information. You know, I'm hoping that this will certainly be very beneficial for those going to volunteer and those who are putting together possibly volunteer packages for people to really understand this, so it can be beneficial for both ends. So again, this is Dr. Shaw with Shaw Medical Travel Consultants, and I'm interviewing Dr. Aneita High, who is a board certified psychiatrist. You know, so I want to thank everybody, and I would also like for you to like this video from Dr. High, and also please subscribe to our channel so we can have more of these videos coming your way. So again, thank you, Dr. High, for being a part of this great interview.
Thank you, Dr. Shaw.
That's a great way to end.
It's great.
So this is Dr. Shaw, and this is Shaw Medical Travel Consultants. Good evening.